The broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon, everybody. My name is Todd Martin, and I have Tashas Shepard here with me. This is the NOVA Quarterly Webinar where we try to give some brokers and consultants and even employers some things to look for in the industry. Now, I know that this is everyone's crazy time of year, and everyone is really busy fighting for renewals, trying to keep those numbers down. So this time we thought that we would bring out something that might help you when you're going through your renewal process. So what we're titling today's presentation is, are you managing your plan, or is your plan managing you? A lot of times people move to self-funding due to a lot of the benefits of flexibility. When that comes to plan design, comes to different types of vendors that they can work with, options with different stop-loss carriers, but they might not always take advantage of all the benefits that you can get. So Tasha and I have been working together for probably, what, Tasha? About 8 years between a couple different organizations. So we thought we would put something together today that really comes along the roads of what our experiences are and really the direction that we're heading and helping our clients maintain and control the cost of positively affecting their bottom line. So as you can see on this chart here, more and more employers are tending to move to a self-funded arrangement for their health benefits. 61% of all companies across the country are actually self-funded now. And our goal as the health benefits specialist move from managing cost drivers versus managing increases. So helping employers identify what's driving the cost within their population on a regular basis versus trying to figure out a way to pay premium increases. So by identifying those cost drivers within a specific population, hopefully those increases won't be as significant as they've been in the past. It's one thing to be self-funded to obtain transparency and flexibility, but it's what you do with these key features that can most positively affect the employer's bottom line. So the 4 things that we see are signs that we believe you aren't managing your plan, but your plan is managing you, are ongoing trends with high-cost claimants, focus on cause versus cause, data without an action plan, and focusing on fixed costs versus plan management. So these are 4 areas that we want to drill down in a little bit more today to help you identify if there's things that you can maybe be doing better with your self-funded employer groups. So ongoing trends with high-cost claimants. When you're self-funded, you get the benefit of transparency. You can see what your high-cost claimants are, who they are, what those conditions could be. And it's that information that makes you be able to adjust plans and make recommendations that you couldn't do when you were fully insured. It's really good to know who and what the high-cost claimants are, especially when they're ongoing. But if you can have some detailed notes, it helps you moving forward, especially with things like stop loss and going out for your renewal on that. A lot of times you might have information on a high-cost claimant, and if that high-cost claimant isn't ongoing, you can show documentation, you can work with the stop-loss carriers that they won't build those risks into your renewal. Those are definitely some benefits that you can get and utilize moving forward. Identifying top cost drivers is very important as well. Often we find specific patterns of conditions within employer populations. This is where client-specific wellness and medical management strategies can help with the long-term outlook of the plan.
And these are always on everyone's radar, but it's more about not just identifying them and having them on your radar, but what are you doing about it? What strategies have you developed to manage the cost as a result of these items, cost drivers? So here's a list of common chronic conditions that we see prevalent throughout our nation. But what our plan does in our health plan performance team, we conduct ongoing individual group and analytics assessments to identify conditions prevalent to specific client populations. Once we identify the prevalence within the populations, in collaboration with our medical management team, we provide recommendations to the clients based on those findings and develop strategies and implement to reduce the risk of increased costs. The med management team takes a proactive approach to engaging members, providing the tools and resources, education, and guidance regarding the importance of their regular follow-up maintenance care, maintaining treatment protocols rendered by the physician, and behavioral lifestyle changes to mitigate progression of their disease. Our goal, again, is to provide the members with the tools to develop a lifelong self-management plan to improve and sustain overall well-being, again, preventing disease progression, exacerbation, and complications. We also provide education to our members for identification of early signs and symptoms of potential problems and help them to develop a plan for early intervention to prevent and to reduce the chance of further exacerbation and the need for unnecessary higher cost services such as ER and inpatient admissions. Our team has a very hands-on approach. The case managers work closely with our health plans and providers and participants to evaluate ongoing quality, cost, determine medical necessity, and work with the facilities for discharge planning. The team, the team has access to resources and tools to identify high-performing network providers. The clinicians are responsible to determine if the services meet medical necessity and provide education regarding lower-cost conservative options when appropriate to provide members the necessary information to make informed decisions. The clinical team works closely with inpatient facilities, discharge planning staff to ensure that the members are transitioned to the most appropriate level of care at the right time, to improve the discharge process and reduce the risk of post-op complications, and to avoid readmission.
So the next thing I want to talk about really is people that focus way too much on cost versus the cause. Obviously, when you're self-funded, you get a stronger breakdown of what your costs are, whether it be on an individual level, whether it be on an aggregate level. You can even drill down to the specific member level to see what their actual costs are. You know, costs are obviously very important, but when I'm working with a client, what we're focusing more on is what was the cause of those costs. Obviously, networks are very important. Network discounts are very important, and obviously we try to make sure that we have a good network and we have good access and discounts for each and every one of our clients. But if we can avoid a claim in general, zero claim is better than a 90% discount off of bill charges. So what we try to do when we're working on an annual review is instead of just reviewing what the costs were in that previous year, we want to identify what was the actual cost for those members incurring those costs over the past year, and what could we do to try and help them manage that. So if you look at this next slide here, the next slide here is actually a handout that you can pull up a little bit larger on your computer if you can't see it. But really what this is, it's a health policy infographic chart of recent trends in employer-sponsored health insurance premiums. And between 1999 and 2015, premiums increased by 203%. That's outpacing both inflation and workers' earnings. However, growth premiums for family coverage slowed toward the end of that time period from an average of 11% a year between 1999 and 2005 to 5% between 2005 and 2015. In recent years, deductibles rose faster than premiums and wages, with the average premium for a single and family coverage increasing 4% between 2014 and 15. This is considerable variation in the premiums at different firms. 8% of covered workers are enrolled in a family plan worth more than $24,000, and 4% are in plans worth less than $10,000 annual. Over half of large employers conducted an analysis to determine whether they offered a plan which would be subject to excise tax on a high-cost health plan slated to take effect in 2018. So I think this just goes to show here that, the costs that are going on within health insurance are increasing at a pace that is unsustainable. Oftentimes, employers have begun to slash things like ancillary benefits, so they're no longer paying for dental, they're no longer paying for disability, they're no longer paying for life, to try and figure out a way to manage the constant increases within their health plan, because that's the benefit that they are required to offer their employees. So they're paying more, the employees are paying more, but most of the clients that are dealing with this, they're not necessarily bringing more in. So that's why we're trying to focus on really not trying to find a way to find dollars to fulfill those cost increases, but actually ways to manage the causes that are causing those increases.
So data transparency identifies trends. Our team deploys thoughtful strategies to help clients manage trends. For example, inappropriate ER utilization. In my experience over the years, there's always been a large focus on the appropriate utilization of ER. A few examples of how we've assisted some of our clients one is through benefit design change. We had some employer groups with high inappropriate utilization of ER that were identified, so we worked with the employer group to implement a process that required members to contact a 24-hour nurse hotline prior to the planned trip to the ER to seek guidance on what was the most appropriate course of action for their condition. If members failed to follow the process, they had a higher out-of-pocket expense. This change equated to a significant change in behaviors and improved adherence to seeking care in a more appropriate setting, thus saving unnecessary costs for the plan. Another example is a plan that most plans, this is not just specific to one plan, but a lot of our plans have seen over the years certain age range of individuals that have inappropriate ER utilization. Those are typically your young adults who have aged out of a pediatrician's office but haven't yet identified a PCP. So these individuals are generally healthy and don't really necessarily believe that they need a PCP. Unfortunately, when they're faced with a sinus infection or ear infection, something of that nature, the only thing they have in their back pocket is to go to the ER. So we have developed a strategy to target these individuals and link them to PCPs to reduce the inappropriate need for ER utilization.
Another one of the things we want to highlight is having access to data without an actual action plan. Data is great, but what good is it if you're not really using it to manage, what's moving forward? Reviewing the data, from the past is great, but it really should be that data that's helping you lay your roadmap, to the future. Tasha actually just touched on emergency room utilization and it being unnecessary. If you have data and you're identifying that a larger amount of your emergency room ER utilizers, maybe people that are non-compliant with medications, maybe diabetics, maybe asthmatics, if these are the people that you are finding are going into the emergency room because they're not taking their maintenance meds, then there might be some obstacle to them getting that medication. A lot of times I found that maybe some high deductible plans might have actually had an adverse effect on, the way people are utilizing their drugs because they don't want to spend their dollars. So by identifying these patterns within the data, we can make a tweak in the plan moving forward. So if we find that diabetics and asthmatics aren't taking their maintenance medications and they're ending up in the emergency room, maybe we adjust the plan design moving forward to make no copay for those members on those maintenance medications. So you might invest a little bit moving forward with immediately starting out that next plan year when you make that tweak of the plan design, but at the end of the day, over the course of the next year, 2 years, you're going to decrease emergency room utilization. So if you can pay for a generic medication at $50 a month, I think that's something most of our clients would much prefer over paying for a $3,000 ER visit quarterly.
So the value of the right medical management program. In addition to the chronic condition management and case management programs, we also work with wellness initiatives. So industry standards shows a large portion of the employers have these initiatives or implement strategies to obtain the biometric and health assessment data, but a large portion of them don't have a strategy to leverage the outcomes of those data and act on it. Our health plan performance team conducts an assessment of the data and develop and deploy strategies with our medical management team for targeted outreach. Identification and stratification of these members who have abnormal values is key. Those members who have been identified with a critical high abnormal value are notified immediately. Frequently, the results of the biometric data is the first awareness that a member may have that they actually have a precursor or may even have a chronic condition. Our team of nurses, in collaboration with the member and their care team, work to develop a self-management plan to reduce their risk of progression and or reduce abnormal values such as high cholesterol, improve blood pressure readings, weight management plans, and more.
And the last topic that we really want to touch on in regards to identifying if your plan is managing you is focusing on fixed costs versus plan management. You know, I have always worked for third-party administrators, so we have particularly always marketed ourselves with a per employee per month fee. A lot of times it's frustrating because a lot of people look at those fixed costs, and those fixed costs are really going to be 20% of the overall claim spend of the entire plan. Typically, your administrative fees, your network access fees, and your stop loss premiums are going to be around 20% of the spend of the overall plan, and then 80% is actually going to be claims. So when you're looking at a solution, make sure that you're focusing on that 20% as the value that it's going to bring to manage that 80%, which is really the larger part of the plan spend. A lot of times they're always taking a look at, you know, $1 here for maybe case management or $2 here for some sort of wellness program. But investing in those types of things will help you manage that 80%. The last thing I would ever want if I was a consultant would be to necessarily select the cheapest TPA because they have the cheapest per employee per month fee, but all they're doing is paying claims and answering phones. If they're just paying claims and answering phones, that 80% is probably going to increase to 90%. And the renewal is going to be ugly because we're not going to have any case management notes to talk about the claimants and what's driving the cost within that plan. And we're not going to have any way to make that plan better down the road. So what I would definitely recommend is work with an organization that can help you look at predictive modeling, somebody that can drill down with data analytics and reporting tools and help you identify the major cost drivers within that population. This isn't something that every single TPA out there can do. And a lot of TPAs might have ways to find what's driving the cost, but they might not have a team to help you implement strategies to help you manage those costs. So make sure that you're getting everything that will help you manage that 80%, because in the long run, what I have found is that the more involved and engaged you are with your clients, whether you're a TPA or whether you're a broker, the stronger that relationship is going to be and the longer that person will become a client. Because every year you're talking about strategy and you're not just comparing numbers. You know, don't nickel and dime on networks either. A lot of times you might have a network come in and say that we have, you know, 8 out of 10 hospitals in the area, but they're only getting, you know, a 20% discount off of bill charges, but their access fee is maybe $5 per employee per month. And you might have another network that has 9 out of 10 hospitals in an area. They're averaging a 50% discount off of bill charges, and their access fee could be $10 per employee per month. Now, that network with the deeper discounts and more accessibility is $5 more than that other network, but you know, one claim being incurred and paid could cover that cost difference for the plan on the entire year. So you want to make sure that you have a network that people are going to have accessibility to, and you want to make sure that they have good discounts. And then also you want to make sure that you're working with a TPA that provides case management services.
And to add to what Todd was just referring to, not just case management services, but an integrated medical management team that can really focus on those members within the right need. So case management typically focuses on those members that are more catastrophic, members who have multiple uncontrolled comorbid conditions, or members who have been diagnosed with cancer, transplant, trauma. Things like that are managed by our case managers. We also focus on chronic conditions and, as I said before, wellness. Our case management team also works very closely and has a very keen eye on managing the cost of services. In the event a member is admitted to an out-of-area facility, the case manager works with that facility to identify whether or not the member would be better suited and it would meet the needs of the plan from a cost perspective to either keep that member in that facility that they were admitted to, or to have that member transferred to an in-network facility. So they do work with the cost containment team to do a cost-benefit analysis, considering the cost of transport as well as the cost of transporting the patient to an in-network facility.
So I guess to wrap up kind of what we've been talking about, when you're doing an evaluation and working on renewals with your clients, make sure that you're working with a TPA or carrier that is bringing all of this to the table and they're doing it at the client-specific level. Every one of our clients at Nova is a little bit different. Everyone is unique. So we don't take a paintbrush and paint all of our clients the same color, because they all have different cost drivers. They all have different demographics. They're in different industries. They're in different parts of the country. So what we do is we implemented a medical management platform that really pulls in any type of data that we can potentially gather on a member, which would lead to us having more information based upon our specific clients. And we're pulling in things like medical claims, pharmacy claims, pre-certifications, prior authorizations, biometric screenings if they so chose to it. And from there, these members really have a risk profile developed, and they're pushed up to our nurses for different types of outreach type programs. So on the member side, that could be a chronic condition type program. So diabetes, COPD, asthmatics, Tash talked about all of it before. Or it could be a case management situation. Is someone going through cancer? Is somebody going through a potential kidney replacement? We want to make sure that those people are getting the highest value care, the most medically necessary. They aren't getting duplicated services. And, you know, we can really be their friend and handhold them down that path. Then we're constantly looking at these groups at an aggregate side based upon that data we have on the individual, and constantly evaluating and looking at different strategies that we can put in place to help them manage what's driving the cost within their specific population.
As Todd said, it's a constant review of the data. So we may review a plan's data and identify that they have a prevalence of diabetes and that we need to focus on the diabetics within their population. The next year, or within 6 months of implementing that strategy, we're going to continue to evaluate that data on an ongoing basis to determine if we've made an impact and if we need to change our strategy or target our efforts in another area that has become prevalent within that population.
So in closing, one thing I kind of want to just remind everybody is make sure that when you're evaluating your partner for your self-funded administration, make sure you're really working with someone that is working to manage the 80% of your client's cost. That is the claims cost. Don't over-evaluate the fixed cost within the TPA fees and within the stop-loss premiums and within network access fees. Investing a little bit in the 20% can really help you control that 80%. Also make sure your TPA partner is giving you insight and action. A lot of times your administrator may be providing insight onto what has happened in the past, but they're not making any recommendations on action plans moving forward. Make sure they can offer dedicated population and trend management services. Those would be different unique strategies specific to your specific clients. It's not a one-size-fits-all solution. And make sure they provide flexibility to make modifications to vendors without disrupting care for plan participants. So those vendors could be certain out-of-network cost containment partners. They could be different networks. They could be different wellness strategies, but make sure that they're coming up with a customized benefit plan that's suitable to your unique clients and your unique needs. If anyone has any questions or would like to talk to us any further, our email is partner@novahealthcare.com. We also have a phone number listed there below, but I know that everybody is busy, and appreciate your time today and would welcome any questions right now. We have a few minutes left here. If not, if something comes up later, feel free to reach out to us at partner@novahealthcare.com. Okay, well, I don't see any questions coming in, so if something comes up later or you just want to talk or you have an opportunity, feel free to reach out to us at partner@novahealthcare.com, or my number 716-932-5105 is on the bottom, and we hope all of you enjoy the rest of this crazy 1/1 renewal season, and hopefully there'll be an opportunity to talk again soon. Thanks.